Good evening, everybody. You are welcome to this session of nursing patient assessment. Nursing patient assessment gathers essential information about patient's health status, needs, and preferences. Nursing patient assessment helps nurses to develop a comprehensive understanding of the patient, enabling them to provide the individualized and patient-centered care. So the nursing assessment guides the development of appropriate nursing diagnoses, care plans, interventions, and evaluation outcomes. Without nursing patient assessment or without assessing the patient, it means that it is difficult for the nurse to make diagnosis for the patient, also developing care plans for the patient, interventions and evaluations. It becomes quite difficult. So it is important that the nurse knows how to conduct patient assessment. Let's look at the scope of nursing patient assessment. Nursing patient assessment encompasses various physical, psychological, social, and environmental dimensions. Let's look at the physical assessment. Physical assessment involves evaluating the patient's vital signs, that is temperature, pulse, respiration and blood pressure, body systems, signs and symptoms, and physical appearance. Psychological assessment focuses mostly on the patient's mental health, emotional well-being, cognitive function, and coping mechanisms. Let's continue with the scope of nursing patient assessment. Social assessment explores the patient's support systems, that is, the family dynamics, the cultural background, and social economic factors. Then the environmental assessment will take into consideration of the patient's living conditions, where he lives, is he living in the town, is he living in the urban area, and the environment, is it clean, is it conducive for living or not. Then when we look at the environmental assessment, it will also assesses access to health care, safety, and also environmental hazards, because a patient could be living in an environment whereby he is exposed to hazards. For example, patients who live in areas where they are carrying out extracting of oil. When they live in such areas, those areas are considered to be hazardous. Let's look at the principles of nursing patient assessment. The first principle is confidentiality. Nurses must maintain strict confidentiality regarding patients' information, respecting the privacy and the trust of the patient. What do we mean by this? What is meant by this is that the information which the nurse has gathered from the patient, the nurse is not supposed to tell the relatives, even the friends, without the consent of the patient. Principle number 2 is respect for autonomy. Nurses should respect the patient's rights, like there are 5 rights for the patient. One of the patient's right is to make decisions about their health care, involving them in assessment process and also considering their preferences. So it is important that the nurse does not dictate upon the patient. The patient should be allowed to make decisions concerning his care. We have to involve him in the assessment process, and also we have to consider what the patient prefers. We should not impose conditions on our patients. Principle number 3 is cultural sensitivity. Cultural assessment should be culturally sensitive, considering the patient's cultural beliefs, values, and practices to provide culturally appropriate care. What do we mean by this? It means that the nurses must be aware of the different cultures of the patients, such that they must treat the patients not forgetting their cultural background and beliefs. The other principle is evidence-based practice. Assessment should be conducted using evidence-based practice, evidence-based guidelines and best practices, integrating the current research and the knowledge to ensure quality delivery. So here it means that the nurses should be reading current research articles, because in the current research articles they are able to look at the evidence-based practices that are being used currently, because these are the ones that help to guide, these are the ones that help, that act as guidelines to best practice and service delivery. The other principle is holistic approach. Nurses should adopt a holistic approach to patient assessment, considering the interconnectedness of the physical, psychological, social, and the environmental factors. All these factors should be assessed because they contribute to the well-being of the individual, and at times they may also contribute to problems that could be affecting the individual. Collaboration is also another principle. Collaboration with the patient, their family, healthcare team is essential during the assessment process, fostering shared decision making and a comprehensive understanding of patient's needs. What is meant here is that when we assess, when the nurses are assessing their client, it means that the family members should also be involved. Why? Because family members will be able to give us some of the history concerning the patient illness, and healthcare team healthcare team is also important, because the healthcare team will also be looking at the patient, and they will be sharing ideas on how the patient should be managed. Professionalism is also another principle. where nurses should conduct assessments in a professional and ethical manner, maintaining objectivity professionally and also ethically. Ongoing assessment. Ongoing assessment, patient assessment is an ongoing process. It does not end. It only ends maybe when the patient has become very well and he is advised and he is allowed home. But otherwise, when the patient is in the hospital or whether the patient comes in as an outpatient, patient assessment is ongoing with the need of continuous monitoring, pre-assessment to identify changes in patient's condition and adapt the care plan accordingly. Effective communication between the patient and the nurse is very important, such that the patient will be able to tell how the sickness began. Let's look at the importance of effective communication in assessment process. Effective communication is crucial and it is important in assessment because it establishes the foundation for building a trust, understanding, and collaboration with the client. In other words, it helps in building up a what? A rapport. So effective communication, the other point on the importance of effective communication in assessment is that it enables the nurse to gather accurate and comprehensive information. So when the nurses are able to gather accurate and comprehensive information, this will ensure the provision of a holistic assessment and patient-centered care. Effective communication enhances patient satisfaction, improves health outcomes, and reduces the risk of errors or misunderstandings. When you communicate with the patient, when you ask him questions and he is able to tell you, it means that the patient will get satisfied. But if the patient asks the nurses questions and the nurses cannot be able to answer the patient's questions, then it means that the patient will be left in suspense. Let's look at techniques of building rapport with patients and families. 1. Building rapport is essential to create a trusting relationship between patients and their families. Let's look at some of the techniques for building rapport. One of the first technique is active listening, paying full attention, maintaining eye contact with the patient, and also using verbal and non-verbal cues to show interest in the patient's concern and also experiences. If, for example, the nurses are talking and the nurse is looking down, he or she is not maintaining eye contact, and no verbal or non-verbal cues, it means that the patient will suspect that the nurse does not have any interest in whatever he is telling. Another technique is empathy, that is the second technique. Demonstrate empathy by understanding and sharing patients' emotions and perspectives. It involves sharing compassion, acknowledging their feelings, and also providing emotional support for the patient. When we talk of empathy, it does not mean that if the patient is crying, then the nurse should also start tearing and crying. No, just the nurse should continue supporting the patient, acknowledging their problems. Technique number 3 is open-ended questioning. The use of open-ended questions is done to encourage patients to provide detailed responses, and this will foster a deeper understanding of their condition, needs, and also inferences. If you ask a patient questions that will involve yes or no answers, those are closed questions. It means that the patient is not going to give enough explanation concerning his condition, need, and preferences. Let's look at theoretical frameworks and modules in nursing patient assessment. Theoretical framework and modules provide a structured approach to nursing patient assessment, and they guide the assessment process and also promote a systematic and comprehensive approach to care. The two commonly used frameworks or modules are the nursing process and the holistic module. Let's look at the nursing process. The nursing process is a systemic problem-solving approach that consists of 5 stages. One is assessment, followed by diagnosis, planning, implementation, and evaluation. Nursing assessment provides a framework for organizing and conducting nursing care, ensuring a holistic and patient-centered approach. Holistic means that you are assessing the patient as a whole. There is no part of there is no any other element of the patient that you are leaving out. Each stage of the nursing process contributes to the assessment process, and this allows the nurses to gather relevant data, identify patient needs, develop care plans, implement interventions, and evaluate the outcomes. Let's look at the holistic module. The holistic module emphasizes the interconnectedness of physical, psychological, social, and spiritual aspects of a patient's well-being. The holistic module also recognizes that health and illness are influenced by multiple factors, and it focuses on promoting overall wellness. The holistic module encourages nurses to assess the patient's physical, emotional, psychological, cultural, and environmental dimensions to provide comprehensive care. Let's look at the importance of evidence-based practice in assessment. Evidence-based practice integrates the best available evidence, clinical expertise, and patient preferences to inform decision-making and guide nursing practice. So when the nurses incorporate evidence-based practice into the assessment process, this will ensure that the assessments are based on most current and relevant research and guidelines. That is why it is important that the nurses should continue reading current articles of research. That is where they will be able to get the evidence-based practice. So evidence-based practice improves the quality of care, it promotes the best outcomes, and ensures that nursing assessments are aligned with the current standards of practice. Let's look at examples of theoretical frameworks and evidence-based guidelines guiding assessment. Example number 1. In the assessment stage of the nursing process, nurses use standardized assessment tools or questionnaires such as the Braden scale for assessing pressure ulcer risk, or the PHQ-9, which stands for Patient Health Questionnaire. This one is used for screening depression symptoms in patients, which are evidence-based tools that provide standardized data for a comprehensive assessment. For example, in the patient health questionnaire, if scores are less than 5, it means that there is absence of a depressive disorder. But if the scores are 5 to 9, it means that either there is no depression or the other. Example number 2. The holistic module guides nurses to consider various factors when assessing patients, such as determinants of health, cultural beliefs, and spiritual needs, ensuring a comprehensive understanding of patients' health status, and also it facilitates in individualized care. Let's look at the importance of systematic physical examination. A systematic physical examination is vital in assessing patients' health. It also provides valuable information about patients' body systems. It identifies abnormalities or potential health concerns, and also assists in formulating accurate nursing diagnoses and care plans. So, the physical examination complements other assessment methods such as history taking, laboratory tests to understand the patient's health comprehensively. Let's look at the use of appropriate equipment and techniques for patient assessment. Performing a physical examination requires appropriate equipment and techniques to ensure accuracy and patient comfort. Equipment used for assessing patients may include stethoscopes, blood pressure cuffs, otoscopes, ophthalmoscopes, reflex hammers, and thermometers. Techniques used during physical examination involve inspection, palpation, auscultation, and percussion. Let's look at the first technique, inspection. Inspection involves visually examining the patient's body and body systems for signs of abnormalities such as skin color changes, swelling, or deformities. For example, assessing skin integrity, examining the abdomen for distension, observing the respiratory rate and effort. Palpation. Palpation involves using touch to assess various body parts, such as feeling for tenderness, muscles, or abdominal pulses. Examples of palpation include palpating the abdomen to detect any enlargement or tenderness, or assessing the peripheral pulses for quality and strength. Auscultation. Auscultation involves listening to the body's sounds using with the help of a stethoscope to assess the heart, lungs, and other internal organs. Examples include listening to the patient's heart, breath, or bowel sounds to detect abnormalities or irregularities. Let's look at percussion. Percussion involves tapping on body surface to produce sounds that help assess underlying structures and identify abnormalities. Examples of percussion include percussing the chest to assess lung resonance, or percussing the abdomen to assess organ borders and fluid accumulation. Let's look at collecting data from various sources. The assessment process involves collecting data from multiple sources to understand the patient's health status comprehensively. Let's look at the key sources for collecting data. These include the patient's history. The patient will tell you his complaints, for how long the complaints have been. Physical examination, this is done by the nurses. Laboratory tests, the patient can be sent for laboratory tests. Then diagnostic imaging, this involves x-rays, and also consultation with the other health care professionals. Let's look at patient history in details. Patient history involves gathering information about the patient's past and current health conditions, medications, allergies, lifestyle habits, family history, and psychosocial factors. Patient history is typically obtained through interviews with the patient, family members, or medical record review. Physical examination. Physical examination involves systematically assessing the patient's body systems. Physical examination includes inspection that we saw, percussion, auscultation, palpation, auscultation, and percussion. Physical examination helps in identification of abnormalities, assessing vital signs, and also evaluate patients' physical health. Laboratory tests and diagnostic imaging. Laboratory tests can be done such as blood tests. There are various tests that can be done in the blood. It can include complete blood count, culture and sensitivity, and so on and so forth. Urine for urinalysis or imaging studies, where X-rays will be involved, and CT scans, that is computerized thermography, etc. These provide objective data to support the assessment. So, the laboratory tests and diagnostic imaging help to diagnose conditions, monitor treatment effectiveness, and provide baseline information for comparison. Let's look at other relevant sources. Other relevant sources may include specialist consultation notes, previous medical records, or patient reported outcomes. These can also give data concerning the patient. Collaboration with other health professionals contributes to a more comprehensive assessment and ensures that all patient health aspects are considered. Let's look at the significance of accurate documentation. Accurate documentation of assessment findings is crucial for ensuring continuity of care and effective communication among the healthcare team. The other significance of accurate documentation is that it facilitates comprehensive patient understanding, it promotes collaboration, supports evidence-based practice, and also helps monitor changes over time. Therefore, it is important that the nurses document all the findings that they get from the patients. Whether they are results, they should all be documented. Because if documentation is not done, it means that there is no evidence. Some other years back, there were complaints that the nurses carry out their procedures, but they don't document. They lack documentation. So if you don't document, then when the physician comes or the other health care team, when they come, they would like to see what you have written down. So if the nurse has not written down anything, then it means that there is no evidence, or it means that work has not been done. Therefore, it is very important that the nurses should document all their findings on the client. Examples of data interpretation. Let's look at examples of data interpretation. Example number 1. Interpreting laboratory test results can help identify abnormal values, detect health potential risks, or monitor the response to treatment. Laboratory values can also detect what? Normal values also, because you never know. Maybe the values are normal, then the patient may be telling you that he's not feeling okay. Example number 2 is assessing physical examination findings, such as abnormal breath sounds or joint or swollen joints, can indicate specific health problems or guide further diagnostic investigation. Let's continue with the examples of data interpretation. Example number 3. Integrating patient history with the physical examination findings can help identify patients' strengths, needs, problems, risks, and the care priorities, leading to tailored interventions. Vital signs are objective measurements of basic physiological functions that provide valuable information about a patient's overall health status. Vital signs are essential indicators of body functions, and they also help the healthcare professionals to assess and monitor the patient's physiological well-being. Let's look at the key vital signs. There are 4 key vital signs. There are four key vital signs typically measured, and these include 1. Body temperature, Body temperature reflects the balance between heat production and heat loss in the body. Pulse rate measures the heart rate, including the number of times the heart beats per minute. Respiratory rate assesses the number of breaths a person takes per minute. Blood pressure measures the force exerted by circulating blood against the walls of the blood vessels. Let's look at the importance of vital signs. Vital signs are essential. Vital signs provide essential information for evaluating the patient's baseline health. For example, the patient may come in and the temperature was maybe 36.8 degrees centigrade. That is the first day the patient came in. Then later on, as the subsequent days pass by, when the temperature is taken again, it could be 38 degrees centigrade. So it means that there is a change that has occurred from the patient's first temperature. So vital signs help to monitor changes over time and identify potential abnormalities or health outcome. For example, if the temperature is too high, or if the temperature is too low, or if the pulse rate is very fast, the blood pressure is very high or low, these are abnormalities that can be identified with the help of vital signs. So the vital signs aid in making clinical decisions, assessing the effectiveness of treatment, and detecting early signs of physiological deterioration. Let's look at the measures of vital signs. Measuring vital signs involves specific procedures to ensure accurate and reliable results. Healthcare professionals usually follow a standardized protocol and use appropriate techniques and equipment for each vital sign. Let's look at one of the procedures for measuring vital signs. For example, if you want to take a temperature, it means that the nurse will have to select the appropriate thermometer based on the method he or she is going to use. For example, if he or she wants to use the oral route, then it means that he or she has to select the thermometer which is used for oral route. Or if he or she wants to use the tympanic, then he or she will use that thermometer which is utilized for the tympanic route. Second point in the procedure is to position the patient appropriately and ensure that the thermometer is clean and also functioning well. Then follow the manufacturer's instructions for the placement and the duration of the measurement. Record the reading accurately and document any relevant information. For example, the route that you used for taking the temperature, the time factors that could have affected the reading. Let's look at measuring pulse rate. The nurse has to identify the appropriate pulse site based on the patient's age and also condition. For example, the radial, carotid, and the branchial, if he or she wants to use any of the above. Second point in the procedure is the nurse should use fingers, that is the index and middle finger, or he or she can use a pulse oximeter to palpate or measure the pulse. The nurse counts the number of beats felt or displayed in 1 minute. Then record the pulse rate accurately, noting any irregularities or characteristics such as the rhythm and strength. Let's look at measuring respiratory rate. The procedure. The nurse has to observe the patient's chest or abdomen to assess the raise visually and fall with each breath. Then he or she counts the number of breaths for 1 minute, ensuring the patient is not aware of being observed. Because if the patient is being observed, then he may change his rate of breathing. So it is important that the nurse should see to it that the patient does not notice that she is counting the breath. The easiest way to do this is that as soon as, maybe if she's taking temperature, as soon as she has inserted the temperature, the thermometer into the axilla, then immediately she starts to observe the chest movements and starts counting the breath, because the patient will not notice it easily. Alternatively, count for 30 seconds and multiply by 2 for an accurate respiratory rate. Then after that, record the respiratory rate, noting any abnormalities or patterns, for example, shallow breathing, rapid breathing, or labored breathing. Let's look at measuring blood pressure. Procedure. The patient is positioned in a comfortable, the position of the patient should be seated comfortably with their arms supported at heart level. Then the nurse should select the appropriate sized cuff, ensuring a snug fit without constricting or sliding. The cuff should fit snugly, it should not be very tight. Then the nurse should place the stethoscope over the branchial artery just below the cuff's edge. Thereafter, he or she will inflate the cuff to a pressure above the expected systolic level and then slowly deflate while listening for crotocough sounds. Then the systolic and diastolic blood pressures are read and then recorded accurately. Let's look at the importance of standardized techniques. Standardized techniques ensure consistency and accuracy when measuring vital signs. Standardized techniques also facilitate reliable comparisons and enable healthcare professionals to identify patient condition changes over time. Let's look at the normal ranges of vital signs. Body temperature typically ranges from 97.8 degrees Fahrenheit to 99 degrees Fahrenheit. If this is converted to centigrade, it means 36.5 degrees centigrade to 37.2 degrees centigrade. That is when the route for taking the temperature is a oral route. Let's look at the pulse rate. The normal pulse rate varies with the age, but is commonly between 60 to 100 beats per minute. Respiratory rate, the normal range for adults is between 12 to 20 breaths per minute. Blood pressure, the normal range is around 120 over 80 millimeters of mercury, with variations also depending on factors such as age and the overall health of the individual. Importance of accurate documentation. Accurate and timely documentation of vital signs is crucial for maintaining an accurate patient's physiological status record. So, it is important for healthcare professionals to track trends, identify changes, and also communicate vital sign information to other members of the healthcare team for effective management of the patient. In summary, we defined nursing patient assessment. We also looked at the scope of patient assessment. We looked at the principles of nursing assessment. We covered the theoretical framework and modules in nursing patient assessment. We also looked at the nursing process. We also looked at the importance of evidence-based practice in guiding assessment. We also looked at physical examination and also the importance of documentation. Thank you for listening and have a blessed evening.